Tell me when we can start. Good morning, everybody. Welcome to all of you, well, maybe good evening for some of you. I'm very pleased to be able to be here with Jamie Bridge, the chair of the Vienna NGO Committee, to open this very important webinar on Family First program, and with my colleague from the UNODC Prevention, Treatment and Rehabilitation section, who will unfold very, I would say, even earlier than the official launching of some program that we will hear later. But before everything, I would like to mention some housekeeping issues. Just to remind you that this webinar is recorded and that there is interpretation, and to be able to use the interpretation, you can choose the language you prefer to listen in, English, French, Russian, by using the drop-down button on the screen called interpretation. It's important that when you listen to your language, you mute the channel original to avoid hearing the original language. Also, there is a chat and there is a question-answer box. I introduce myself. I'm Mirella Doumafrahi from the Civil Society Unit. Sorry, maybe I said something wrong because there is also Spanish, right? Yes, Spanish. Sorry, my notes were a bit. So we have, just to repeat, we have English, French, Russian, and Spanish. Okay, good. My name is Mirella Doumafrahi. I have the privilege to lead the Civil Society Unit in UNODC, which is directly under the Division of Policy and Analysis and Public Affairs, while you will hear later my colleague, which are in the Division of Operation, and as I mentioned before, on the really substantive section. This event is organized together with the Vienna NGO Committee, which is one of the NGO umbrella organizations with whom UNODC work when it comes to issues related to the World Drug Problem. The Civil Society Unit, for many who knows us, and I know there are many familiar people who are on the session, so warm hello to all who are following this session. We are a bit the entry point when it comes to engagement with civil society. We facilitate your participation at the different intergovernmental meetings. And just to say that the next big one, the Commission on Narcotic Drug, will take place on 14-18 March 2022. So please note the dates. We really hope that it will be an in-person event, but of course we learned with the pandemic to do also hybrid event, and this is how here at UNODC most of the meetings are taking place. Yes, as we are speaking of the pandemic, we all know how difficult it was for some families, especially during the lockdown, to deal with substance abuse issues. And I personally also was, during the lockdown walking around, and I met a friend of mine that I had no idea that, her son was going through such a difficult time, and she was asking me for advice, help. Unfortunately, even if I work in UNODC, and really, it's very important to have the people who can give some scientific evidence-based response, and I just could give my friendly advice, having had myself children and having been lucky that they haven't went into this very difficult time that this friend was going. So this is why today it's really so important to hear of the Family First and Family United and Strong Family program. And just so that you know, this is the UNODC will launch on Friday, which is the World Children's Day, this next phase of the Listen First initiative, and that Elizabeth will kindly announce a few of the aspect of it. So I'm very really excited to hear about this new material, and I will not say more. I pass to Jamie to introduce himself. And we are actually also, I want to mention that that all this event takes place thanks of the program coordinator that we co-chair with Jamie, and Sarah is also in the room. So yeah, thank you.
Thanks, Mirella, and yeah, definitely to say a big thank you to Sarah for kind of putting this together. So yeah, welcome everybody. It's great to see so many of you here. We're over 80 people on this webinar. The number is going up, so that's really fantastic. Thank you for joining us, and thanks particularly to UNODC Civil Society Unit, which Mirella heads, and also the Prevention, Treatment and Rehabilitation section, PTRS, for co-organizing this event with the Vienna committee today. So yeah, as Mirella says, my name's Jamie Bridge. I am the chair of the Vienna NGO Committee on Drugs, or the VNGOC. So I work for civil society, and the VNGOC itself is a global committee. For those who may not know us, we're a global committee of around 300 civil society organizations from all around the world. And we work to support engagement between civil society, between NGOs, and the key UN agencies and the key discussions on drugs, such as the one we're going to have today. So our work includes producing guides and providing support around engagement with the UN Commission on Narcotic Drugs, which Mirella mentioned earlier, and the next big meeting for that commission will be in March. But we also do webinars like this one, and I'm really glad that we've been able to put this webinar on together, you know, just a few days before World Children's Day. I think it's really good timing from our side. And you know, this is just one of a series of webinars that we've co-hosted with UNODC during the year. We've also had webinars on UNODC's HIV work and on the conventions and on all different aspects of the work, just to help civil society to understand the different processes, understand the different projects, and be part of this kind of effort. We also have a platform called the NGO Marketplace, which maybe Sarah can share a link in the chat. And for those of you who may not be on the marketplace, I would once again really like to encourage all civil society partners to create a profile. It only takes a few minutes to do. And the NGO Marketplace is kind of a sharing platform where we can learn about each other's work and kind of make connections. And that's, again, something that we've been able to do thanks to the support from the Russian government, but also from UNODC Civil Society Unit. So I'm going to be moderating today's event, and we've got a fantastic lineup of speakers. Just before I hand over to our first speaker, just to say that we are going to do everything we can to ensure that there is time for questions at the end. Please keep yourselves on mute during the event, but you can use the Q&A box. Hopefully on the bottom of your Zoom screen, you'll see an option for Q&A. Please use that to submit any questions that you may have. You can submit questions at any time. It's better for us if you put the questions in the Q&A box rather than in the chat, because as you'll already see, the chat moves quite quickly and we don't want to miss some of the important questions that you may have. And some of our speakers may actually try to respond to some of those questions in writing while the session is going on as well. So please do keep using that Q&A option. So I think that's it for me, really. So without further delay, it's my great pleasure to give the floor to Elizabeth Matfeld, who is the Global Coordinator for the Listen First initiative and works at the Prevention, Treatment and Rehabilitation section of UNODC. So Elizabeth, over to you. Thank you.
Great. Thank you very much, Jamie. Can you just give me a sense of, you're thinking about 20 minutes. If I start to go over time, please intervene. I won't see you if you write something in the chat, but please intervene.
No problem.
Because fortunately, this is a topic I could probably talk about for an hour and a half all by myself. So let me share my screen and get started. My name is Elizabeth Matfeld. I work with UNODC now for 10 years. I have experience working in both prevention and treatment fields and have worked, I started out my career working as an NGO and then with NGOs. So the work that we're doing now is Listen First, or what I've been asked to speak about is Listen First. Listen First has been in existence since 2016. So some of you on this call have probably heard about it, but I hope to share a little bit more insight today because it looks easy on the outside, but sometimes when you get into the materials, you see how it is a little bit more complicated. So what is Listen First? Listen First is not a campaign. So many people have in the beginning thought of it as a standalone campaign, but it is not a campaign. However, there are materials that are associated with Listen First that you might be interested in using in a campaign, and we'll talk a little bit about that. The underlying principle of Listen First is that prevention really is founded or based on active listening. At all levels of evidence-based prevention, we need to be thinking about some form of active listening. All of the pieces of Listen First are linked to science and the international standards on drug use prevention. We intend for all the materials to be fun and engaging. One of the things that sadly has happened throughout history is that when we talk about substance use prevention, sometimes we use scare tactics, or we might even exaggerate or use hyperbole to really say to young people, you know, using drugs could be harmful or hurt you or is bad. And so we wanted to move away from that negative connotation and make it fun and engaging. We also recognize that it is global resources. So we did our best to deal with the issues of diversity, be inclusive, be representative of people around the world. I want to be clear that the Listen First materials should not be used as standalone materials. They should be incorporated into an existing prevention approach or system. And so you will see as we go along, there are materials, but they do not work, they will not be evidence-based prevention as standalone. So oftentimes people will say to me, is this been evaluated? Because it's not a standalone program that we would be evaluating in that way, no, it has not. But we do have data collection, and we count on you all who are interested in using the materials to help us with that data collection so that we at least can start to monitor more accurately the reach of the materials. So UNODC Listen First is really in 3 different phases. The first phase really focused on 3 videos that talked about the 3 key areas of prevention. And then we moved into last year's materials, which focused on parenting, significant challenges for parents during COVID, dealing with the issues within lockdown and all of those kinds of pieces. And we'll talk a little bit about that for today. And then Morella already hinted to this, but today we are actually sharing with you some resources that will be launched tomorrow and Saturday as well. So our original materials focus in 3 areas. primarily talking about active listening. There's 3 videos. The second video is about, we call it ice cream rules, but it's about how do you deal with children who are breaking the rules? How do you have a consistent message? How do you engage with children and communicate those the consistent messages that you need to establish when they might be breaking the rules? It's a really great and engaging, it's actually my favorite video. The Sandcastle parent involvement video is actually about how do we encourage or get parents motivated to get involved. And it really goes through a little scenario about what can happen if you aren't involved, and then how different it can be if you are involved. So those 3 videos were the first videos created in 2016. Many member states supported that. And recently, last year, we actually added the science sheets to go with them. Those videos are available on our website, and the science sheets are also available. So they, even though it was from 2016, the messaging is still valid, and we encourage people to use that. They have a little bit of a longer video, so they are not videos that are made to be used for social media, because as you can imagine, that has grown since 2016, and you'll see in some of our other materials how we've addressed that. For these videos, please know that for the primary funding was from France, as I said, but a lot of the member states have already been involved, and we're welcoming you to use those videos. We often encourage people to use those videos as introduction to discussions, introduction to a discussion with a policymaker about the importance of parenting, introductions to a parenting class, parent involvement in schools. These are the kinds of things that you could play and use as resources that engage people in the conversation. Last year, we launched our Science of Care, and I won't speak too much about the background materials because Wadi will speak about that. But the Science of Care focuses on 10 videos and 10 science sheets. And all of those are built upon the materials that UNODC developed for parenting during COVID. So the 10 areas are science of affection, science of family activities, science of active listening, science of play, science of patience, science of praise, science of physical activity, science of information, science of routines, and science of staying busy. And you'll notice, or maybe you won't notice, but I will point it out because it's fairly subtle. All of the 10 videos are designed to be animations within a house. Occasionally you see pictures outside, but it's outside within the house of the people who are featured in the video. And so the animations tell the story and demonstrate how parents can work well with their children. So for science of play, how you can play with children. For science of patience, how you can have that patience when children might be really driving you a little crazy. In fact, in the video, they're upside down on the ceiling, for those of you who have seen it. So again, these are based on science. Each of the materials, each of the videos has a science sheet that goes through the main points and gives you talking points about the science behind these messages. One of the things that's really important for me to share with you is that the decision to focus on science is really driven by this idea of not engaging with, right or wrong, judgment, moral judgment, anything to do with illicit markets or illicit markets, the legal system, the criminal system, all of those things we wanted to set aside and only focus on what's behind the science of being a positive parent. How can you help your children to learn and grow and develop into healthy adults? And so that was our focus with the Science of Care. I should also tell you that all of these materials are available in English, French, and Spanish. And for the Science of Care, we have a number of civil society partners that actually are most likely on this call, who were able to support the translation of these materials into their local languages, Slovenia, Serbia, UAE, and those materials are also available on our website. So you can use these from different countries, different languages. We encourage you to reach out, and I'll tell you how to do that shortly. Okay, now we are growing and let me go back for a moment to say that in our Science of Care videos, so the first videos were completely animation. They don't have talking, they have sounds and music, but they don't have talking. The Science of Care materials have animation, but we started to bring in real pictures of real families. So we actually have families that are showing and demonstrating the skills that we talk about and the information that we talk about. So those videos are interspliced with real life families doing the activities. Again, that was an opportunity for us to focus on diversity. I'm happy to share with you today that we are growing to the point where we are literally growing in age. And so instead of focusing on parenting and parenting skills, we are going to a focus on primary age children. And we're looking at the skills. So all of us on this call, if you have knowledge about the evidence-based prevention, you know that social skill development is one of the key protective factors that we can provide for children. So our Science of Skills that are launching today, tomorrow, and Saturday are featuring 5 videos. There are 4 super skills characters that are special. They have something unique, but that something unique can often make them be a little bit uncomfortable because they're different. And so these skills that they have and that they develop are the things that we want to focus on for young people. We have 10 science sheets. They focus on competencies. So we have linked the skill development to empathy, compassion, respect, gratitude, honesty, integrity, confidence, hope, motivation, and curiosity. These 10 things really contribute to the skills that we want to be developing. And we link all of the science sheets. So the back of each science sheet will focus on social and emotional learning. This is what it looks like. You'll see a science sheet that has all of the information for science. And the back of every sheet will focus on growing your super skills. So looking at self-awareness, how do you recognize your emotions? What do you do with them? How do emotions influence your behavior? Self-management, thinking before acting. Are you able to set and achieve your goals? Do you recognize your emotions and how do you manage those? Responsible decision-making, very clear that young people need work in that area. Stress management is also one of the key social and emotional skills that we know contributes to substance use prevention. And then relationship skills. How do we build positive relationships? How do we communicate in a positive way? And again, linking it back to listening first. How do we promote active listening? Now, the new materials have also come or given us an opportunity to make some changes in our website and to engage with you as partners in a different way. So you'll see the website. The website has been updated, and we have 3 areas of engagement that we really want to highlight. One is member states. So member states who have done work in this area, who perhaps have launched some of the materials, have supported civil society to use the materials. We want to highlight those member states on our website. Slovenia, I've already mentioned. Serbia, Poland is looking at work in this area. Iceland, Finland, a number of countries are pulling this together, and those member states will be recognized on the website. We also have a part of our website for key stakeholders. That would include educators, healthcare workers, policymakers, parents, and substance use prevention and treatment professionals. So you as civil society partners, if you know of someone who's doing great work and who is incorporating the Listen First materials that are available, then please do let us know or encourage them to go to the website and let us know. We want to highlight them. We also want to provide as much support as we can. We also have a page, an engagement page for partners. And for many of you, you may be best placed to be looking at that partner engagement page. What can we do? How can we work together? What ideas do you have for getting these materials out within the scope of your work? If you're a regional partner, if you're an international partner, if you are just a local NGO meeting the people's needs, how can we work together? What can we do to support your work? And how can we help you to use these Listen First materials? Now, there's a couple things to know as an engagement partner. One, all three of those areas are highlighted on the new website. And we just ask that if you want to use these materials, please do complete the form and give us some information about yourself, and then we will provide all of the information you need. That could be if you want to use the materials and you need them translated. You can let us know if you're interested in working with us on the translation and you have the means to do the actual translation. We will provide you the materials once you've provided us the translation. It could be that you want to talk about, you have a prevention system and you don't know how to fit the materials in. You're doing work in a parenting group and you want to use the materials, but you're not sure how. That's something that we can also help with. So I encourage you, anything that we can do to provide support, technical support, advice, information, additional resources, please do reach out to us. We do also have a newsletter, a monthly newsletter that we send out to each month that highlights all of the work being done around the world on Listen First. Again, some of the partners on this call have been highlighted in that newsletter, and that's a good place for us to be able to highlight the work that you do. So please do go to the website, click subscribe for the newsletter. And one of the things that we, as I said before, are trying to pull together is how much Listen First is being used. Again, we cannot say that it's effective as a standalone program, but we can say how far the reach has been, how many children have seen the materials, how many NGOs have used the materials, how many school teachers have engaged with the materials. And in order to find that out, we ask that you share with us that data. So if you've done something, please do give us that input, give us some information. On another level, we want to hear from you if you want, or if you think that there could be a new way for Listen First to be used. So for example, we started out with young children and families. We've now grown to primary age children. As we continue to grow, we're looking for your input as to what might be the next steps. What do you see as a need within the communities that you work? And I leave you with this, if you want to take a screenshot or you want to write down the website, www.unodc.org/listenfirst. And today, we have gone live with our new website. We have not published that and let people know, but certainly as members of this particular webinar, please do go and see our new resources. And I will, Jamie will allow me to, I will stop sharing my PowerPoint and I will share the first video, the sneak preview of the first video.
Fantastic. Thanks, Elizabeth. While Elizabeth is just setting that up, just to let everyone know, the link is also in the chat. So Sarah has also put that link in the chat so that you can visit the Listen First website. We will obviously, as Morella said at the beginning, the recordings from this webinar will also be made available. So you've got all that information will be, you'll have that to hand after the call as well.
Thank you, Jamie. And I'm going to keep my fingers crossed that everyone hears and sees.
the super skills of compassion and respect, we and other people can feel bad. But growing our super skill of compassion makes us kinder and helps us and our friends grow stronger too. Compassionate children feel better about themselves. It's scientific. Grow your super skills and thrive.
Great. Thank you, Jamie, for letting me play that. I hope that it did come through. And one of the things I wanted to say is that, there'll be a series of 5. And so these 5 videos that come out will come out approximately every 3 weeks. Through most likely C&D will be the last time we share the last video. And I do really encourage people to use them, to think about them creatively, and to be in touch with us through the website.
Okay, fantastic. Thank you so much, Elizabeth. And and as I said, the link, so you can view all of that amazing material and the videos and everything when they're ready. Everything is in that link which we have shared in the chat. So thanks so much, Elizabeth.
And
really
a reminder, it's in English and French.
English,
so
okay, perfect.
I just showed
Thank you so
English
much
today.
Thank you so much. Okay, so that's fantastic. As I said, please do submit your questions using the Q&A box, and I'm sure that we'll have time at the end of the call for Elizabeth to come back to some of those, or maybe to answer some in writing as we go. So right now, I'd like to hand over to Wadir Malouf, who's also from the UNODC Prevention, Treatment and Rehabilitation section. And Wadir is going to talk to us about the Strong Families and Family United initiatives that they are working on. So Wadir, over to you.
Thank you very much, Jamie. And I'm really happy. I'm really glad that you have selected this specific topic for more than one reason. It so happened to be a project that I've been coordinating for a while. Actually, I joined UNODC in 2005, but out of all projects I covered, this is the project I enjoyed the most. It's a project that focuses on changing the culture of prevention. So it focuses a bit of working with policymakers, but in terms of availing tools to service providers to work on evidence-based practices, the main tools that have been articulated in this project are family skills. And coincidentally, it's a project during which I became a parent myself. So many of the things that I'm going to talk about are things that I'm personally kind of benefiting from too. So given that there's a group of NGOs and civil society organizations here, and also pass the word also gratitude to Mirella and the civil society unit as well for the support. I would start by actually providing you with information that could be of use in the context of family skills in the work that you're doing at the grassroots level, which is very important. Beth alluded to the international standards on drug use prevention that's available in 2 different versions, the latest being in 2018 with the WHO logo. And I guess that's a very important cornerstone of what we preach in terms of prevention. I think given the context of COVID-19, prevention, WHO standards, I think this would echo a lot in terms of the value of science that goes in when we say that these are evidence-based practices to our policymakers when it comes to actual impact on preventing drug use. But why is it important is the fact that the main core content of the international standard is the fact that, yes, there is science, but not any prevention is evidence-based prevention. and which is an important point that Beth alluded to, because many times our member states are focused on the idea that prevention of drug use is talking about drugs, raising awareness about it, and raising fears about it at times. Or at the other extreme are programs that really focuses on just say no perspective. And these are important elements to kind of change with regards to the policy making as well as the service provision level, bottom up and top down, really, in the context of the standards of prevention. That prevention really in terms of a science goes way beyond this. And it comes as a surprise for many policymakers, really, that a lot of the evidence-based prevention programming that we preach and we put in the field does not discuss drugs at all, even though it is intimately linked with prevention of drug use, much like you saw of the wonderful videos in terms of the science, whether it's the science of care or the science of skills, you know, that Beth mentioned. You will see there's no drugs. But we're talking about programs that really develop the intellectual, language, cognitive, emotional, and social competencies of kids. So we're working with policymakers for them to stop focusing on the drug as a problem, but really focus on the individual and how you can help that individual grow in a healthy and safe way. So that's the cornerstone of the work that we're doing. May it be work that we are doing at the individual level to build the resilience of the kids themselves, much like the skills of that are being portrayed in the Listen First new material, or in the institutions around the children. So that's a key important element of the work going forward, because when we talk about substance use initiation, every person have their own characteristics, their reactivity to stress, their level of aggressiveness, their neurological development, their genetic coding, their mental health. All of these things are things under the skin that people differ even within the same family. Even if they share the same family, brothers and sisters have a different sort of personality and personality characteristics. These people also are influenced by these structures, important social structures: the family, the school, the peers. But even the family, the school, and the peers exist in a larger structure. So a family that is parenting in challenging context is different than a family that's parenting in a normal context, where there's war, there's refugees, displacement, there is domestic violence in the family, there's substance use in the family. These differ, right? So they affect how the family function, but they also affect the person individually. That interactivity of all of these personal microstructure and macrostructures are what we work on in terms of engaging with policymakers to understand in different ages of development, every child requires a different need, whether it is on their individual needs to reach that milestone or the institutions around them to help them reach that milestone from birth onward. And these same vulnerabilities that are linked to substance use initiation at a certain age are vulnerabilities linked to mental health issues, to academic failure, to violence against children, and many other sort of negative social and health outcomes. And that's a core component why we have a large diversity of work that we can engage with policymakers, and actually work that we can start from infancy, from the time the child is still in the womb of the mother even. There are evidence-based intervention that are by the WHO standard showing an impact on preventing substance use of that child at adolescence. So that's how early you can start. And then you can see diversity of actually social institutions you can work with. There's a lot, but you will see a diversity of colors too. So there are certain interventions that are universal. So basically any child can benefit from them, regardless of what condition the child is living in. These are the green colored interventions. There are certain interventions that are selective, meaning that there are for a subgroup of the population that are at a higher level of risk than the normal population. And that's in yellow. And then there are certain interventions that are indicated, meaning that these are for certain kids that are showing some symptomatic issues at an early stage where you can intervene before it evolves into something, you know, more elaborate. And that's an additional layer of importance to understand in terms of providing what to whom at what age of development through which social institution and beyond. And the prevention standards actually determines the characteristics of the actual programs that are listed here, what works, what does not work. So the prevention is not a standalone, it's part of the work that you do in terms of the comprehensive care in terms of the health response to drugs, if you want, from health promotion to universal selective indicated prevention, and the spectrum goes to treatment and beyond. But you can see where indicated start bordering with treatment. So I'm going to go back to the family, and you see that within middle childhood, we're not saying specific ages, but let's say middle childhood are early school years, and early adolescent is, you know, when the child passes the age of 11. There are lots of evidence-based activities that we can put in place, from family skills to life and social skills development that differs by age. You know, at early stages, you can help the children really recognize their emotion, the emotions of others, who understand who they are, how to build relationships. But in the later stages, we can start thinking about how to challenge normative belief, how to resist social pressures. These are important skills that the school, maybe other institutions, can provide. School policies, there are a lot of things that can work, but when we talk about, you know, the thinking process of you're helping a child develop their own resilience, and you're helping social institutions around that child support that level of resilience, you can understand why, for us, in that context that we're preaching for policymakers, family is a key social institution. Because unlike any other social institution, it is one where people in that institution share genes, share a history, and share a future together. So basically, if you change how that family functions, it really sort of have a long-lasting effect, and at different ages of development of the children. So after talking to policymakers, when we go in terms of availing these tools to them, they change the strategy, but then they need the tools. Family skills is one of the valuable tools that we work and engage with policymakers to promote. But also, because we're UNODC coming in talking about family skills, many times the Office on Drugs and Crime knocking the door of a certain institution, telling them we want to work on family skills for preventing drug use, they think that, you know, these are tools that help moms and dads really become better law enforcement officers at the home to really detect if their children are using drugs or not, which is not the case. These are skills, much like the skills that are, you know, in the science of care, that help parents really communicate better, have a better trustful relationship with their kids, solve problem, have conflict resolution, have better relationship, you know, have a more fluid relationship between caregivers that could be the biological parents or not, depending on where we are, and the kids that are being cared for. So there is that bonding and attachment, and actually this is a skill. It's not a one-time thing that you can do. It's a skill that needs to evolve with the changing age of the child. So it requires practice. And that's why Beth is saying that, you know, these are important messages for parents, you know, that to understand in terms of the science of care. But really to develop that skill, it requires more of a, you know, if you want to build the skill of the family to change their parenting practices, it probably requires a larger engagement. You know, maybe you nudge them by the videos, but you need, you know, a program that helps them develop these skills. And this is where we have been working for since 2010 onward. Actually, from 2010, let's say, to 2017, we had evidence-based family skills program that exists in many countries that we're working in terms of transferring that knowledge to low and middle income country where we are working. So some of these packages are for early age groups, and some of them are for, you know, let's say early school years, because the family skills there are different than early adolescents. You know, others are for early adolescents. One of the obstacles we have faced was always where we are working. No, our families are different than the families where these programs are being designed. And actually our work and our documentation of effectiveness in the diversity of cultures, you will see from the countries listed there, really represents the fact that regardless of the race, of the age, of the culture, or whatever, a certain child at a certain developmental age requires something from the people caring for them to help them grow, meet their milestones of development. So that skill is needed universally. How that skill is probably like determined might differ from one to the other, but the science remains the same across all the different cultures. And we have taken these programs that are evidence-based packages that are developed in the United States, in North America, or in Western Europe, and documented that these same science can be transferred and documenting effectiveness. we faced a couple of issues, mainly in the area of, yes, the science is the same, but the infrastructure implementing these programs in high-income countries might not exist in low-middle-income countries where we're working. Things as simple as the availability of electricity sometimes to play a DVD that showcases a family having an issue and discussing that with the others, or the development of the DVD itself. When you see white faces, Northern American or European, and you go to other countries and they feel like a lack of association, and then you have to produce these videos with different faces, and so all of this comes, the royalty and copyright fees of these programs, because they're owned by university, is also a burden. So basically this is where we have started to learn from our experiences that existed between 2010 and 2017 to develop our own programs as UNODC that are open sourced and are designed for low and middle income countries to really continue with what have been planted as seeds of programs that the families felt an affinity to, that they want to move to scale and move forward. And that is why we have developed these two packages that you see in front of you. One of them is called Strong Families, which preceded Family United. Strong Family is a package that is very light, but it focuses on parenting in the context of stress. So that stress might differ, right? You can be parenting in a situation of very low infrastructure, a poor infrastructure. I see Begonia really here from the Dominican Republic, where she has decided in Dominican Republic to use it in favelas, in underprivileged societies. But there are also families that are in displaced setting, refugee setting, where, I'm grateful for my colleague Amir, who's going to talk about the experience of strong families in the Cox's Bazar with Rohingya refugees. So maybe natural disasters. Actually, we're all parenting now under stress when we are talking about parenting in the context of COVID-19 and its challenges. So it focuses a lot on stress, recognizing your stress, the stress of children, and how to really kind of have the same faculties that I talked about, but in a context of stress. Needless to say that these packages are not developed by UNODC, they're developed by experts really. Some of them are experts that develop the sort of programs that I talked about, like Strengthening the Family 10 to 14, or Incredible Years, or other packages, Triple P, that existed. So basically we borrowed from their experience, but also from the experience of the countries where we have implemented for over the last 10 years. Family United, unlike Strong Family, is a universal. So basically Strong Family is selective. Families living in more stressful situation than the normal families. And Family United is more universal, but is also designed to be for low middle income countries, meaning that both programs require ingredients and materials of coloring pens, coloring pencil, string, a balloon to blow, paper plates, these sort of issues to carry along in a bag, but nothing more significant than that. And actually both of them can be implemented through facilitators that are lay facilitators. Basically, you don't have to have a certain experience in any sort of field. You need to have a good rapport and a good way of talking to people and engaging to people, maybe a good communication and a good relationship with your community. But that's all you need. You can be trained and you can take this package and you can be trained on its content to facilitate its content to families. These are some of the photos that really show from the field what are we talking about in terms of needs. So basically you see paper and pen, you see some photos from Tanzania, some photos from Iran, some photos from Zanzibar, some photos from the Philippines of implementing strong families, and in Kazakhstan, in Palestine. And this is a picture that is really close to my heart, and particularly currently in the circumstance that this is from Afghanistan. And then, because sometimes many times we see like the photos of humanitarian assistance and social assistance work are very sort of, let's say, providing a kind of a depressive tone. But it's important to note that, in any context, the hope, the relationship, the positive attitude, the playful attitude can happen. And that carries a large impact on kids. And being a war child myself, growing up in a war situation in Lebanon, I understand the value of such sort of positive relationship with at least one of the social institutions around you that can support you and grow better. So again, and this is in the remote areas of the Philippines where there are lots of natural disasters as well. Strong Family is available now in more than 10 languages and have been piloted in more than 20 countries. I will not go too much into its details because maybe my colleague Amir will talk about how it's been implemented in Cox's Bazar, but it's implemented in different countries. And Family United is also merged with these, but we have a smaller group of countries working on Family United and a larger working on Strong Families. But some of the results, for example, this is to document its effectiveness. We have a standard scale that we use in many sort of social studies of the strength and difficulties that the parent kind of attributes to a child. So it generates a score of different subscales where you can see at baseline where the families where we have piloted, and this comes from Afghanistan, in terms of the level of strength and difficulties they're facing with their child at baseline, which is close to orange and red being, something at the clinical level of difficulty faced with that child. And the program is 3 sessions of 5 hours overall for the facilitators, but it is 7 independent hours because some of the sessions are running in parallel. It can be implemented in a total of 5 hours over 3 weeks. 1 hour first week, 2 hours the second, and 2 hours the second. And you see, like, that's what I want to reflect how light it is. And you can see, despite that, these same parents rating their children over time, time 2 being just shortly after the intervention, and time 3, 6 weeks after the intervention, where the rating of their children went to the normal level of, of what difficulty they should face at a child of that age. Then we have zoomed in for the particular subgroup of families where they were almost on the red zone, which is a higher level of the SDQ at baseline, and we followed them up, and we saw that the parents with the most difficult children also have their children rating improved to normal after 6 weeks taking the intervention. We also saw, which is not surprising because that's part of the prevention standards that reflect the fact that family and parenting skills are packages that are really gender sensitive, which is something very important for us as UN in general. We see that these packages work equally for boys and girls, where we see their rating at baseline have improved both regardless of gender over time. So it's all started in Afghanistan and spread to many other countries. I will spare you the details, but that's one package that we have. And then based on this experience of parenting under stress, we have worked with Manchester University, and due to the unfortunate circumstances we are living in before Corona, of a high level of raising number of refugees and displaced population, where it was estimated 1 out of 116 families really is a displaced family globally. We started experimenting on different versions of how the packages of assistance can be availed. From something as basic as leaflet of information, because there's a difficulty to reach these parents and they need minimum information in terms of, okay, how do I understand my stress? How I understand the stress of my child? And we have distributed and worked with Manchester in terms of distributing these leaflets, for example, for Syrian refugees in Turkey, and with information that has been put in bread bags. So basically the bakery that is baking the bread would put these messages and distribute this bread to some of the families that are displaced as refugees in these camps, but some of the families that are Turkish family living there. With a feedback questionnaire to to respond by mail on its value. And then the response was overwhelmingly positive, and there's a publication on this that we can share with you on the value of this information. But for those families that can engage for a minimum amount of time, we have developed also a booklet of caregiving for children in conflict settings. That booklet is a bit more advanced than the leaflet. It has more detail, but it is either self-led or could be supported by a 1-hour presentation with PowerPoint with notes. And I'm drawing this to your attention because all of these tools require zero training, available in many languages, and you as civil society organization could use, and you can contact us and we can avail it to them. So we have a clinical trial on families that are in Palestine, in Nablus, where we have documented the effectiveness of these programs, and the publication can be available to you. Strong family require more interactive sessions. So we have to bring facilitators to be trained, and the facilitators need to bring families to work together and engage. But also, when there is a context of trauma, which is in the displaced population very frequent, unfortunately. We also work with the University of Manchester there's a package called Teaching Recovery Technique, which is a package that is developed by the Norwegian Children of War Foundation. And the University of Manchester were testing, okay, if we use this package as a package plus parenting, can it be beneficial? And this is where we have seen that we have a clinical trial on Syrian refugees in Lebanon to share with you. I see Jamie coming up. I might be late. I'll squeeze in the information. So I'll wrap up. So there are several publications to share with you. The PowerPoint can be shared, but any of these articles that you're interested in, I can share with you on supporting the evidence-based in recipient countries, on changing the culture of prevention, and on refugee-focused work that I talked about. And there are upcoming chapters that could be of interest to you. Currently, we're living in a context of COVID-19, where the level of stress in parenting is high, violence against children is rising to an unprecedented level, and mental health is rising in parents and their children to an unprecedented level. So these packages are very important now more than ever. We have produced parenting under COVID-19 leaflets and booklets integrated in the Listen First campaign that really are available in many languages, free of charge. Download them, distribute them, but just let us know that you use them. The Science of Affection, the Science of Care is a very welcome package, came at a timely basis, as a chapter of the Listen First campaign. But I will end on this slide saying that these family parenting skills packages coming in from an international standard of prevention are a common denominator to many other strategies that can be supported, ranging from prevention of children being recruited by terrorism, that was a larger area, but you can imagine a good family functioning, how much it protects the children in the context of that's happening. The Inspire initiative to end violence against children, the prevention of violence that WHO led, and you will see in the guidance that the Helping Adolescent Thrive to prevent and promote mental health in children and adolescents, where we see strong families, one of the packages being there. So these are packages that support sustainable development goals. And by that, I'll revert back the floor to you, Jamie.
Thanks so much. And yeah, if it's okay, if both you and Elizabeth can send your slides to Sarah, we'll make sure that those go up on the VNGOC website so that people can capture all of that information that you've included. And I do really appreciate both you and Elizabeth managing to condense all of this amazing work that you do into 20 minutes. That is such a difficult thing to do. So thank you so much for that. So I'd like to now give the floor back to Mirella, who is going to introduce our next speakers in the session. Mirella, over to you.
Thank you very much, Jamie, and thank you to Elizabeth and Waldis for this very interesting presentation, and to see that they work also so much with multi-stakeholder, NGO, academia. We heard of them. And so before introducing our NGO speaker, I wanted just to mention something, as Jamie has thanked the Russian Federation for the financial support, that this webinar is funded thanks also to the contribution of the United States State Department, INL, that has been supporting also our activities with the Vienna NGO Committee. And now we have the pleasure to have two NGO representative civil society service provider from two continents, Asia and Latin America. Central America. We will start with Dhaka Ahsania Mission from Bangladesh, and Amir Shah, who has been working very closely, actually also with our colleague in the prevention session. DAM provide a wide range of humanitarian service, including in the health sector, where they deliver maternal and child health care, addiction treatment, rehabilitation center, prevention, and also including non-communicable disease care. Amir, the floor is yours.
Thank you. Thank you. Thank you all. And in Dhaka, it's now evening, and just the Maghrib Azan is started. Anyway, good. I am starting my presentation, and thank you, Wadi. You have shared a clear picture and given some information about the Family Skills Program. So I am just sharing my slides, and it will a very short slide for 10 minutes for me, I know. So I just sharing my slides. It was just 30 seconds. Okay. Okay, may all of you are seeing my slides? Okay, fine. This is Amir, as a clinical psychologist and addiction certified professional, working Dhaka Asana mission as a project coordinator of prison intervention project, along with a facilitator and technical lead the Family Skills Program from Dhaka Asana mission in Bangladesh. This is my so Dhaka for all of your kind information, Dhaka Asana mission established 1958, and also they are the member of Vienna NGO committee since long, and also the United Nations affiliation with United Nations agency, UNESCO and UNODC. The actually we have implemented two programs, Family United and the Strong Family Program. Already Wadi shared it. So the the program objective was that to strengthen the capacity of families and caregivers to prevent the negative social outcome in children. The assessment, the assignment is especially important the family skills, caregivers, and the children well-being, which will help to ensure the positive and effective parenting skills. And already this also mentions Wadi, and I think this program is really appreciated in Bangladesh because in our country the context is there is not high, mental health issues is not very widely spared, the mental health support. So there is not a very huge scope to get the parenting and other stress management issues is not very available. So Dhaka Asana Mission started this activity since 2019 after getting the TOT from the UNODC in Indonesia. After that, Dhaka Asana Mission started the piloting through the UNODC program, and the main stakeholders were in Bangladesh along with Dhaka Asana Mission is the Ministry of Education, Department of Narcotic Controls, which is the Ministry of Home Affairs, and the Department of Social Service. All of the involved of this program, very initial stage, and they are as their logo. The Family Skills Program in Bangladesh started 2019 in Dhaka. In Dhaka, it was a pre-piloting program where is selecting a school through the Ministry of Home, Ministry of Education, where we have conducted a small Family United program piloting where it was a co-education schools and 29 families attended that program, and it was the 3 months program. Total 9 trainers from DAM has facilitated overall the program, but overall 17 facilitators in Bangladesh along with the government also, whereas the teachers, clinical psychologists, government service holder, it's a multidisciplinary team. The moments it was the 2019 pictures where the education minister of Bangladesh, Dr. Dipu Moni, and the co-education minister, Mr. Muhibul, and the team of the United Family Skills Program team, and the participants are is there on the it was a learning sharing program after performing the first piloting in Dhaka. So here is the minister, Shochi, secretary, and the facilitator teams along with the participants are here, and we shared the program, a Family United program, with them. And it was some moments of the Dhaka where school we have provided the family skills program in Dhaka. So some moments you have seen. The trainer school already have seen the here the clinical psychologists, government teachers, the Department of Narcotic Control representative, social welfare, Minister of Social Welfare representative, and NGO representative like Dhaka Asana Mission. And the strong family programs, it is already already Wadi also said that this is then for the special situations. So the forcefully displaced Myanmar nations, we are calling the Rohingya people in Cox's Bazar, who came in Bangladesh 2017. So for their Dhaka Asana Mission has conducted through the collaboration with UNODC and UNHCR, and the RRC, the local government, I think the local administration, all of them, the collaboration, we have started piloting and for two intervention in Cox's Bazar last November 2020, and 2 cycles has completed there, and recently we have started 4 cycles, and for all of the both host community and the Rohingya community, the camp community. This as some moment. This is some pictures of the last years. The families are taking the training, and it is a child session and the family sessions, and also there are the caregiver session. Also some moments, it is the camp's pictures where the family has taken the family caregiver sessions and also family sessions last year. And this year we have just started after getting the permission from local administration for conduct 4 cycle. And the picture recently, just I have gone from the Cox's Bazar last 2 days ago after conducted a session. It is the host community. So already also will conduct it for 3 cycles also, and hope we will be conducted in after a few months later. But the program was very the program is very catchy, and when we implemented it Dhaka, the family members of the caregivers appreciated really, because they told me that they didn't get such kind of training and such kind of training before, because in Bangladesh lots of the training is focused for the children or client, but not as a complete focus along with the family, where the children, family members, and caregivers and the family. So the program was highly appreciated in Dhaka, and Cox's Bazar also, the local administration, RRC are saying that they are also appreciated this program, because they also requested us to implement it the host community, and that reason we have started the host community. So my time is very short, 10 minutes. But there is some challenge. So though the program is very effective, we have seen in here through the interview of the caregivers and the children. But in Bangladesh, especially both the non-challenging and challenging situation, some challenges. In the Cox's Bazar, we have faced the administrative process, because this is a country very, very sensitive issues of the Rohingya issues, because they are forcefully come in Bangladesh. So the local administration very alert about it, and they have checked all the materials, and they have checked all of the process, how the training will be conduct, any kind of activities are going in camp situation, they have assessed. So this is very difficult for us to getting the permission, and also but we have done it, and look, because we are working the government body with also, that's why we have processed. But environment is also very challenging in camp, because in camp there's a lot, not have a very big room, classroom, but there is a very hot environment, and the facilities of the room is not very high. Not a single fan, electrical fan also there we have found. So, but we have done it, but also the room setup, and especially the language, they have totally the Myanmar language. But when we have implementing started the implementing the program, we have hired the lots of volunteers who have the came from the Myanmar and working as a volunteer in the camp, and we have included them with us for assist us in this session as interpreter. So it was very easy, and but we have overcome the challenge of language, but the language was also a challenge for us. But the scope of work, we think the program is very very catchy, and I have shared it some professional network informally, and they are very interested to know about the program. Recently, I have talked with one of my friends working in Cox's Bazar IUM. I told him about it, and he was very excited. So how this is a very short program, but looks very effective. And I think if we conducted after completing the piloting for both the Strong Family and the Family United, and when we will share the results with our stakeholders, I think it will be take the government and will be implemented all over the Bangladesh, and I think it will be a very good program. And I think UNODC definitely support here with the government bodies to implement this program, because Dhaka Asana Mission implementing as a small area, but if we do it through the UNODC in the country context, I think it will be a very, very, very effective program for Bangladesh, because in as a mental health professional, I am seeing here there are lots of people, parents are suffering to maintain for some positive parenting issues. So I think it will be really helpful for them. So we have a videos, and I have completed my 10 minutes, but there is the link. You can visit here to see our videos. In the Strong Family in the Cox's Bazar, the video was where you will get the sessions and others issue in this video. So if anybody interested, you can say visit this videos, and you can see the video. So thank you everybody, thank you all, and thank you the UNODC to call and given the space as a space to say something about the Strong Family and Family United program. So thank you all, and thank you Wadi, and thank you the UNODC. Thanks everybody.
Thank you very much, Samir, for presenting how you could implement Strong Family and Family United in Bangladesh, of course, so with the government, and it shows how also from an NGO it triggered the authorities to spread the example to other parts of the country. So very interesting, and thank you for joining us late, even if we could hear that there is still a lot of life in the street from the noises. Now we move to another continent, and it is my great pleasure to introduce Dr. Carmen Fernandez, from the Executive Director of the Centro de Integración Juvenil in Mexico, who had recently their international congress, which took place on 26 and 27 October, which focused on mental health. And I thought it was important also to hear their voice. Carmen, your turn. Thank you.
Thank you. You also.
Thank you, Mirella, for the invite us to present our parenting model. I want to share screen, but I already saw the screen of the last speaker. Thank you. Thank you, Mirella, for inviting us. I will spend 10 minutes to present a very short presentation about our program. Let me say to you that there are a lot, very much evidence about the role of the family in development health or development problems. We have a big system of the epidemiological data about the drug consumption and the tendency of consumption, the substance use in my country. The first drug use is alcohol, tobacco, marijuana, a combination of 3 of these drugs. And in the last years, the tendency is growing very, very, very much methamphetamines. In the other hand, this is about 350 patients. In the other hand, we have research about the dual pathology, and the most pathology, for example, with user of methamphetamines is antisocial personality disorder. This disorder is the result in other researches about the families that fulfills the special functions of provide security, effective nutrition in the members. The families with a violent context. The violent context is the most risk for have mental health problems and for use drugs, for problematic use drugs. The research about dual pathology is related with some common use of drugs. This example is about methamphetamines, about antisocial personality disorder. The prevention program in CIH for develop, we use the international standards on drug use preventions published by UNODC. We use all the standards that you, all the materials that you publish, and we are in some expert groups about that. The objective of prevention program is generate strategies to prevent and reduce the use and abuse of psychoactive substances, as well as the risk factor associated with the strength and protective factor to allow the healthy development of children, adolescents, youth, families, and community. I want to say that the 30% under 18, the 30% of our patients are persons under 18 years old. Many children and many adolescents living in negligence, lack of cares, or family violence contexts, including physical context, including sexual context. The 90% of our clients are living in these families, and the 30% of our patients are under 18 years old. This is a program based in the standards. the program is divided in many contexts: school, workplace, health institution, community. Especially in the school and communities, we attend families. We attend 2 million, more or less, families in communities and in schools. And there are most evidence that the work with families works. The results are very good for preventions. The potential of the family to be is showing the most powerful protective force. Healthy family relationships can prevent people, especially the youngest, from mental health problems, from problematic drug use, from violence, from crime, from risky sexual behavior also. In the school that we work with the prevention program, the growing of use drug is less than the school without prevention programs. In the school context, we organize conference, forum, workshops, many kinds of activities. And we work psychoeducational workshops on life skills with children and socio-emotional skills with adolescents and young people to strengthen their life skill, life decision, making self-esteem, social skills, also critical thinking, critical media information, and media control. All the abilities that Elizabeth and Mr. Malouf comments and is writing in the standard of preventions of UNODC. In workplace context, we have the diagnosis and strategies to increase risk perception about drug use and its impact on the family and work performance. The work with all these workers is about his role of parents. And so we have many workshops for orientations parents. 2020 and 21, in the pandemic of COVID-19, we made many online materials and hybrid prevention intervention are available in many technology platforms. We have multimedia resources and digital materials that support online preventive interventions. Preventing campaigns are disseminated on social workers. All of this material is in Spanish and is in our website. The materials, the objective is to develop parenting skill and positive parenting strategies. We have a program, a school for parents, and the objective is to develop parenting strategies. Is all the objective. With this model, we attend many peoples in 900 cities of the country. We have 120 centers of prevention and treatment. We develop also a model of treatment, multidimensional family therapeutic model of treatment that includes gender perspective and care of violence, violence families, also addictions. Both programs are in our web. Thank you very much, Mirela, for inviting us. This is one of our centers. I have one of these back of me.
Okay, thank you very much, Carmen. Thank you so much for that presentation. And yeah, and as Mirella said, it's great to hear the how this work is being done on the ground, and how all the guidance and the research and the data that UNODC have are contributing is helping with the work that you do in Mexico, and also Amir also in Bangladesh. So thank you so much for your intervention. That also brings us very nearly to time. I think we were due to finish this session at 2:30 Vienna time, so we're nearly there right now. There have been lots of questions, and in particular, lots of questions around how to engage further, which I think is really, really encouraging and really welcome. And I can see that Elizabeth, that you and Wadir have been responding to the questions in writing, which is great. So just for the purposes of the recording and for those who may not be reading the Q&A box, I think, Elizabeth, if someone does want to engage further, if someone does want to learn more and wants to, I think I've seen messages from Nigeria, from Russia, from Zimbabwe, people saying, how do we engage with this? How do we become partners? If they go to the Listen First website, there's one of the menu options there is for partners, and you can click on that link and complete an engagement form. And that will then go to the UNODC colleagues, who can then follow up with you in due course and see how they can explore it. Have I captured that right, Elizabeth? Is that right?
Absolutely, you have captured it right. And just for a little bit of extra information, for many people, they're interested in different languages. And so all that they would need to do is invest in translating the materials. I would share it with them in English, and then they can translate it into their own language. We just review that very quickly, and then we give all of the materials in camera ready form. And so you just drop in the translations. So you don't have to worry about hiring graphic designers or anything like that. We do all of that work for you. You just need to do the work of the translation.
Amazing, amazing. So thank you so much. And I do really encourage people to do that follow-up and to reach out to Elizabeth and Wadir and to our other speakers. The recordings will be available on the VNGOC website. The slides will also be available with all those links and all those references as well. So we'll make sure that's all on our website for you to look at. So all that's left for me to say, I think, is to say thank you so much to everyone for joining us. Thank you to Elizabeth and Wadir and Amir and Carmen for your interventions. And thanks once again, Mirella and the Civil Society Unit, and Sarah, our project officer, and UNODC for co-hosting this. And thanks. It's been a very, very interesting discussion, particularly for me as someone for whom prevention is not the area of work that I specialize in. So it's been really, really interesting. And I've really appreciated everything that you've presented. So thank you, and let's continue the conversation.
Shall we meet for photo?